Hello, everyone. I am Peter Bertone, and I'm a graduate student in bioengineering at the University of Pennsylvania, and my company is Expansa. So at Expansa, we are developing a novel medical device aimed at effectively and comfortably treating symptoms of pelvic organ prolapse while enabling the user of this device to comfortably insert and remove it on their own. Evelyn, who is a 71-year-old woman that has just developed symptoms of pelvic organ prolapse. POP is a common medical condition among women in which one or more of their pelvic organs becomes displaced into the vaginal space. So Evelyn is not alone with this condition. There are 6 million other women who suffer from this condition in the US last year. And at the age of 80, women have a 20% lifetime risk of developing symptoms. Evelyn, who was referred to a urogynecologist, was then given the option to either undergo reconstructive surgery or to use a pessary. A pessary is a reusable silicone device that's seated within the vagina to support and prevent displacement of the vaginal wall and pelvic organs. So with a stage 2 prolapse, Evelyn has been fitted with the most common treatment option for moderate to severe stages of prolapse, a Gellhorn pessary. Gellhorn pessaries, although effective in treating some symptoms for some short amount of time, are rigid, painful, and uncomfortable for the patient. And insertion and removal of this pessary cannot be done by the patient themselves. Thus, Evelyn, it requires to return to her clinic every 3 months for maintenance and cleaning visits. And because of the design of this pessary, 56% of the women that use this treatment option discontinue after 3 years. At Expansa, our solution to treat pelvic organ prolapse is a deployable expansile pessary whose design and mechanism enables the user to self-insert and remove the device on their own, which equates to 50% faster outpatient procedures, increased patient satisfaction and clinical outcomes, and requires 0 maintenance visits. Our deployable pessary easily passes through the vaginal opening when inserting and removing the device, enabling the patient to insert, deploy, unlock, and repeat the process wherever and whenever they see fit. The Expansa pessary is the only treatment option for moderate to severe prolapse that enables the patient to remove the device on their own. With an established predicate device, the Gellhorn pessary, our pessary has a clear 510(k) regulatory pathway. Our pessary leverages a novel patented design and expansive mechanism that improves clinical outcomes and pessary retention rates. Of the 6 million women who suffered from pelvic organ prolapse last year, 2.85 million of those women were patients that used Gellhorn pessaries, where 300,000 initially elected to have surgery. We believe we can target both of these populations of patients immediately to give them short and long-term benefits. With a $300 million US pessary market in 2020, we believe we can initially address a $142 million market and a $16.5 million market. At parity pricing to key competitors, Expansa's pessary will fall within existing CPT and HCPCS codes while still offering high gross profits. Our pricing target at $60 per Expansa unit is at parity with Milex and Cooper surgical counterparts or pessaries, and we still offer a 91% gross margin. Our third year of sales with 15% expected market share, our gross margins will exceed $30.8 million with a customer acquisition cost of $9.25. With an indirect sales go-to-market model for a reusable medical device, Expansa is currently seeking out a strategic partnership and licensing agreement with Cosm Medical, with our short-term goals being to produce a prototype that will be used in animal clinical trials this summer, and we continue to generate interest using social media, academic publications, and trade shows. Our team is composed of highly trained physicians and engineers dedicated on making a difference for patients continuing to suffer from ineffective and uncomfortable treatment options. In the end, with high unmet patient needs, a large and growing addressable market, we are armed with primary interviews and product testing that has shown high potential for adoption. With a strong patent position and a clear 510(k) regulatory pathway, our team of passionate experts is driven on developing the first ever comfortable pessary that effectively treats symptoms of pelvic organ prolapse for patients like Evelyn and the millions of other women who suffer from this condition every year. Thank you.